Hello everybody and welcome to this public meeting of Sheffield's Health and Wellbeing Board. My name is Councillor George Lindars-Hammond. I'm the co-chair of the Health and Wellbeing Board and I'll be chairing the meeting today. I just want to start the meeting by recognising the passing of Kirsty Gurgras, who was a Sheffield GP and a clinical director leading the response for COVID from Sheffield CCG. Her funeral was yesterday, and just on behalf of Sheffield's health and wellbeing community, I want to remember Kirsty and give our best wishes to her friends and loved ones. Thank you all. First of all, because we've got some new faces to the public here today, I'd like just to do some very brief introductions. So I'll just go around the screen as I see it and ask people to very briefly introduce themselves and who they represent. Thank you. I'll start with Mark.
My name is Mark Tuckett. I'm the Director of Sheffield's Accountable Care Partnership.
Hi, Mark. Sandy.
Hi, thanks, Chair. Sandy Buchan, Director of Commissioning Development for Sheffield CCG, here on behalf of Brian Hughes, Deputy Accountable Officer.
Hi, Sandy. Rosie.
Hi, I'm Rosie May. I'm a Policy Officer at Sheffield City Council.
Hi, Rosie. Mike.
I am Chair of the Sheffield Health and Social Care Foundation Trust.
Hi, Mike. Dawn.
Hi, I'm Councillor Dawn Dale, Councillor for Shire Green and Brightside and Cabinet Advisor for Children, Young People and Families.
Hi, Dawn. Abby.
Hi, I'm Abby Brownsword. I'm a Principal Committee Secretary. I'm taking the notes today.
Hi, Abby. Dan.
I'm Dan Spicer. I'm Strategy and Partnerships Manager at Sheffield City Council.
Hi, Dan. Judy.
Hello, I'm Judy Robinson. I'm the Chair of Sheffield Health Watch, which is the watchdog for citizens of Sheffield about health and social care.
Thanks, Judy. Simon.
Yes, hello. My name's Simon Verrill. Excuse me, I'm Superintendent in South Yorkshire Police with responsibility for neighbourhoods and partnerships.
Thanks, Simon. Maddie.
Hi, I'm Madeline Forge. I'm the Chief Executive at Voluntary Action Sheffield.
Thanks, Maddie. John.
Hi, John Doyle, Director of Strategy and Commissioning at the People's Portfolio in the City Council.
Thanks, John. Eleanor.
Hi, I'm Eleanor Rutter. I'm a consultant in public health. I'm here both on my own behalf today, but also on behalf of Greg Fell, the Director of Public Health, who should be joining us later if he's able to.
Thanks, Eleanor. And Terry.
Afternoon, I'm Terry Hudson. I'm a GP in Sheffield, Chair of Sheffield CCG and co-chair of this committee.
Thanks, Terry. Can I ask you that if we've had any recorded apologies today from anyone? I would note just before asking that several members of the committee have let me know about various needs to leave a little bit early today. So you may see people leave early. Terry?
So Sandy's already acknowledged Brian's apologies for absence, and we've also had apologies from David Warwicker.
Thank you, Terry.
I've got a list if you want me to go through the list.
Yeah, please could you go to the list, Abby, if that's great, thank you.
Okay, so we've already had apologies from Brian Hughes and David Warwicker. I've got David Hughes, John McElraith, Lorraine Manley, Tony Schwartz, Leslie Smith, Mike Hunter, Councillor Paul Wood, Zach McMurray, Alison Knowles and Chris Newman.
Thanks, Abby. And do we have any submitted questions at all from the public?
No, not this time, thank you.
That's fine, thank you.
Chair, could I please just offer Councillor Drayton's apologies?
That's fine, thank you, Dawn. Thank you.
Apologies, Chair, she was on my list.
That's fine. We're going to record that's brilliant. And now looking at the agenda for today, can I ask if anyone has any declarations of interest on any matters that are on the agenda today? Terry.
So declaration of interest in the item regarding the commissioning plans as chair of the CCG.
Thanks, Terry, noted there. So now I just want to announce both a slight change of the order and also one late item, which I'm going to deal with very, very briefly today. So firstly, because of the late arrival of Director of Public Health, Greg Fell, there's a plan to change around item 5 and item 7 on the agenda. So that is to the change around the items on engagement and on the report back the rapid health impact assessments. And so is everyone okay with that today to make that change? And secondly, not an item for the debate at all today, but we've had it raised that it may be known to members of the public and the committee that there is an engagement report on the future organisation of health systems from NHS England with a very short turnaround time, which it might be of interest for the Health and Wellbeing Board. Any actions the board would take on this in conjunction with the other partners in the health system would naturally have to be outside of the public meeting, outside of any meeting, because I believe the deadline is very short. But I just wanted to bring in Mark Tuckett from the ACP to just very briefly introduce what might be needed and possible. Thank you, Mark.
Thank you, Chair. And I won't speak for long, but you're right that NHS England published a policy engagement document a fortnight ago, integrating care, next steps to building strong and effective integrated care systems across England. The report's available on NHS England's website. It signals a clear and a clearly preferred direction of travel on a number of different fronts. It explores putting ICSs, integrated care systems, so for our context, that's South Yorkshire and Basset Law, onto a statutory footing. But there are big implications in here for approaches to commissioning, big implications for Sheffield CCG as an organisation, and big implications for our place partnership working in Sheffield, and also for providers of health and care services. As an accountable care partnership, we've reached an ambition to put in a collective response to this, recognising that there will be organisational responses to this too. You're right, George, that the timescales on this are very tight. The ask is that responses are received by the 8th of January. In some of the immediate conversations on this, there remains a lot of enthusiasm within Sheffield to retain and secure commissioning functions, expertise, relationships within Sheffield, and that our work at a place level is not restricted or limited to just being a health provider collaborative. I'm going to be working with partners across the ACP to develop that response. And with that deadline of the 8th of January, the Accountable Care Partnership Board is aiming to sign that off. There won't be time for a formal or full meeting of the Health and Wellbeing Board, but I'm very happy to pick up with you and your co-chair, Terry Hudson, outside of this meeting to see how we could get some sort of Health and Wellbeing Board endorsement or fingerprints on that as well. So happy to explore that further now or follow that up with you and Terry separately.
Thanks, Mark. I feel we don't have much time to add to and much discussion today, but I'll make two brief suggestions. Firstly, that we make sure we, if we can, circulate that report to all members of the Health and Wellbeing Board, and then naturally we will, as chairs, circulate any proposals we might have for Health and Wellbeing Board involvement in that response. And furthermore, if it's possible to put a link to that report within the minutes of this meeting for the public, I think that would be very helpful. Is there any questions or comments anyone wants to briefly make on that before we move on? I'm not seeing anything. Okay, that means we can move towards the preordained agenda for today. And what we have first, there being no public questions, is the report on the CCG commissioning plan.
Thank you, Chair. So I've brought the paper today as Sheffield CCG has recently refreshed its commissioning plan and commissioning intentions for 2021 in light of the COVID pandemic and the implications of that on our population as we continue to go through it, as well as looking at what health needs are required on a continuing basis. The plan details the work that we've undertaken in terms of acknowledging the challenges that we continue to face as a city and incorporates the work that we're doing jointly with Sheffield City Council on developing a joint commissioning plan going forward. So we have got a number of aligned commissioning intentions that are still in progress in being developed for the remainder of this year, as well as the next steps in terms of what we're taking to develop that joint plan for next year. The paper also includes the work that we've been doing on the Better Care Fund programme, and very much tries to detail how we've aligned all of the aspects of the work that we do within our commission intentions to the objectives within the health and wellbeing strategy. So very much indicates how that alignment from the CCG, how we've aligned our attentions to the ACP objectives with our joint commissioning colleagues, as well as through to the health and wellbeing objectives. I'll take the paper as being read, and basically wanted to articulate how we've refreshed them, how we've identified what we're continuing to do for the remainder of this year, as well as what we're planning on developing for next year. But pretty much wanted to come and provide assurance to the board on our full alignment and continued commitment to the objectives of the Health and Wellbeing Board. And that's really pretty much what I wanted to say, and open it for questions.
Thank you very much, Sandy. Does anyone either have any questions for Sandy or any comments on the paper at all? Right, Terry, please. Noting your interest. I think we can't hear you at the moment, Terry.
Right, able to hear me now? Good. Okay.
Brilliant.
Yes. Noting my interest here. So I think this is probably on behalf of CCG colleagues, on behalf of the board, but also with an eye to our joint commissioning function in Sheffield as well. Just want to note really that this is a very different way to which we've brought together our commissioning intentions between the local authority and the CCG previously. I think it does put us in a stronger position, and perhaps gives board slightly more assurance about alignment and that future focus, particularly noting Mark's point earlier about potential changes on the horizon for health and social care nationally. So my comment really is just to say thank you for all the staff, both in the CCG and the local authority, that have been involved in working up something that gives us a better oversight of what's going on collectively than we have had before.
Thank you very much, Terry. Any other comments here at all? Judy.
Yeah, a couple of comments. On the commissioning principles, Sandy, you say that you will involve the people of Sheffield in decisions. Can you say a little bit more about what that means? And then on a very particular one, if I could, just interested in the home care sector. You talk about independent sector resilience. Looking across at other policies around creating good jobs, do you see some opportunities around the care sector for setting up alternative sorts of provision? I'm thinking of cooperatives and carers working together, who have a very different approach perhaps to some of the market-driven provision.
Thank you, Judy. In regards to the first query, we very much engage with our population and collect feedback in terms of informing all of our programmes of work and commissioning intentions. And it very much steers our way of what it is we want to deliver and those outcomes, and also making sure that we monitor them so that that very much aligns with what people are saying is needed to be implemented and changed. So we do make sure that the feedback is a big part of the development and continued delivery of any changes we do make, or incorporate that within the commission intentions. And we have had a very big focus on that, especially during COVID. So during the pandemic, whatever services and functions we've put in place, we have managed to engage with different communities that might not have engaged with before, such as the deaf community and BAME community, especially during this period. but that engagement fully informs the work that we do, and we continue to use that engagement and feedback to inform any decisions going forward as part of our planning process. So hopefully that answers the first one, but very much that is a huge part of what we do and how we shape the work that we're doing. In regards to the second question, I think we will look at any opportunities that are available in order to ensure we're delivering what it is that's needed for the Sheffield population. And I know the work that we're doing with Sheffield City Council on identifying what is available, what can be utilised in different ways, which can include obviously the independent sector. And I think any ways that we see will help the population of Sheffield is very much the direction we want to go in. So at this moment in time, I cannot say whether or not that is something that we've taken into account for the remainder of this year, but obviously is something that we will look into with our colleagues in the council.
Thank you, Sandy. Is that all right, Judy?
Well, I think it's perhaps a longer conversation about the engagement aspects, which maybe we could take up at a future time.
Yeah, I'd appreciate that.
I think that might be useful. I think different parts of the community would have different views about how effective that is. I know it's hard to do.
Right, thank you. Any other questions or comments on this report, please? Maddie.
Hi, Sandy. Really welcome the focus on health inequalities and on communities. The section of the action plan about resilient communities in the VCS, I wonder, again, it might be worth a further conversation. It feels quite top down. It feels about service delivery, and it feels like it's about putting multidisciplinary teams into communities. And I just wonder, there's something about working with communities to understand the assets and then how it can be built bottom up as well. And it feels, building on the COVID response, that if we're going to really tackle health inequalities and help people to manage their own health, that's where we need to be at in terms of focus. So I just wonder if there's a way of pulling that out a bit more, of thinking about the assets in the communities rather than the assets that the CCG is deploying, and thinking about how we can enhance and support them.
Absolutely. Tackling health inequalities is certainly alignment throughout all the objectives, from the Health and Wellbeing Board to the CCG, and as part of the COVID response, and the National Phase 3 letter certainly identifies areas of health inequalities that we need to focus on. But the CCG in itself are wanting to do more, and I know that the same with our colleagues in the council as well. And so we are looking at working with our local communities to see what it is that we're able to do in order to tackle the health inequalities across Sheffield. It's something that's ongoing, that's developing, but as you say, it's certainly been flagged up during the COVID pandemic, and it's certainly something that we're having a really big focus on within the CCG. So I'm happy to talk about it to you more thoroughly outside, but yes, absolutely, it's a big priority for us moving forward.
Thanks, Sandy. And Terry, did you want to come back in?
Yeah, so just final points really to support what Sandy's just been saying there. I think that this report's important, as Sandy's outlined, in that it kind of maps out our organisational commissioning intentions, firstly against the health and wellbeing strategy, but also secondly against our partners' plans, both in the local authority and within our accountable care partnership. And I think just a reflection back here is that on the points of engagement and also the points about building those resilient communities, I think those two things are probably beyond the reach of Sheffield CCG as an organisation to solely be able to solve those problems. The final part of this document almost sort of starts to dip its toe into the next cycle of commissioning. And I think there's something about articulating that ambition that we work with system partners in the ACP, but also with the local authority, Sheffield City Council, to have those discussions further, Maddie. So not only would Sandy and I welcome those conversations as the CCG, but I think George may well nod away here at this one, but we'd probably welcome those in a joint commissioning and also in that accountable care partnership space as well. And the points that Judy makes about engagement, I think that that's relevant in all of those different spaces equally. So engagement's always a tricky one, and I know Judy's got some expert views for us on that one. I do think it is worth also just pointing out in relation to the engagement, NHS England have just rated the CCG as outstanding for its last 12 months of engagement. So whilst the perfect endpoint is almost sort of something we should always be striving for, I think it does tell an important journey about the ways in which we've engaged differently to get these commissioning intentions to perhaps how we've done those in the past. So some big progress has been made there, but there is always room for improvement. And I think, with an eye on how we do that once as a system, just picking up on points around Health and Wellbeing Board engagement, that we don't want to be having the same conversations with the same groups of people several different times. So I think there's something about building that in.
Right, thank you all for those questions and comments. I believe there's probably just one item within that paper that just probably just needs noting particularly, really, which is just about ensuring that, as we've done before, the board is happy with Terry and myself as chairs, just ahead of the next public meeting, to have that oversight on the Better Care Fund expenditure. Just want to check there's no objections to that, really. That being the case, unless there's any other notes anyone wants to make here, we'll close the item. Thank you all. Which now brings us to the slightly reordered agenda, which is what is item 7 now into items 5 slot, COVID-19 rapid health impact assessments. We will remember that this was dealt with at our last public meeting, where we had presentations and discussion around the work that taken place in this area. And now you'll see in the agenda today, we have the document, the main document containing those, but also a document explaining some of the board's work around them. And I'm just going to ask Eleanor Rutter, who's led the work to bring them together, although we should definitely note that these impact assessments are the work of so many people across our health and care system. Just to introduce this and some of the discussions we've had as a board around this. Thank you, Eleanor.
Okay, thanks, George. And yeah, just to start off by saying, whilst my name is attached to having sort of led this piece of work, it is the work of quite literally hundreds of people from across Sheffield. Discussing this here today, it sort of coincides with the publication of the entire report, which is in excess of 400 pages. It's quite an impressive document, really. And if people haven't had a really good in-depth look at it, I would recommend that you do that, because it's a lot of people put a lot of hard work into doing that. However, just to recap, I'm assuming people have read the paper, and I don't want to kind of spend time talking through that again. Just to recap, the health impact assessments were commissioned by the board back in May. We, as a city, needed a systematic way of trying to document the impact of the COVID-19 pandemic and the response to it, which was what we all know as kind of lockdown primarily. That was enable to understand how the health has been impacted in Sheffield, but also to try and have an evidence base from which we can rebuild moving forward. As George said, the overarching findings of those reports were brought here in September, when we had a good discussion about those. And I think it's fair to say they were really well received by the board, who were supportive of the general direction of travel. However, concerns were raised at the time. I think people didn't want to be unsupportive of the recommendations made by the authors of that report. And actually, I think in trying to be supportive, the board drew attention to concerns about the recommendations that were made. Firstly, there were too many for the board to manage to kind of scrutinise those in any detail at all. There's around 100 recommendations in total. I think at times they were too specialist, particularly given that we weren't bringing the actual authors to the board, enable for the board to be able to scrutinise specialist members of staff. Too disparate as well in working very rapidly. Some people had gone right into operational detail type recommendations, which is not really the business of this board. And then the opposite end of the spectrum was that at times they were too far reaching. They were wonderful and aspirational, but it was issues that were at times just out with the control of the board. I think to have kind of supported the recommendations in a sort of blank, just entire way actually would have been a disservice to the amount of work that had gone into that. So actually quite a lot of work has gone on behind the scenes between then and now to think about how we could kind of alter the not the recommendations, but help alter the wording really of helping the board to engage with those recommendations or relate to them in a way that would make them a reality. So it was about ensuring that it wasn't a rhetorical, bland overall support, but these recommendations became something that we could view as real actions for the city in the context of the health and wellbeing strategy. I'm going to talk about recommendations, which is one word being said too many times. I do apologise. But actually the recommendations in this paper are really quite important. The wording of those are important. And George, I don't know if you want to talk through the recommendations one by one, or if you would like me to, or how you want to take that.
What I was going to suggest is I was just going to recap the recommendations, six or whatever, at the top of the paper, just ahead of a discussion, really, so that people note it. But I mean, feel free to do that yourself if you'd like to, or I'm very happy to.
Well, I'm happy for you to, George. I'm happy to sort of hand over from this point and give it over.
Yeah, that's fine. Thanks, Eleanor. And Eleanor's naturally here to answer any questions and things. So I think we should just turn to at the top of the agenda paper, not the tabled full document. Obviously, we've got some recommendations which are the result of some work outside the meeting. The board have been made aware of and consulted on virtually. That clearly it's about noting the impact on health and well-being identified in this in these assessments, and the recommendations then made by those contributing, and also what is really important, as I mentioned there, the response has already happened, because if you read the paper, what you see is that this is not just about long-term suggestions. There's a variety of different timelines, I think, really associated with any response to the assessments and the recommendations within. And then really crucially, I think one of the things we talked about before as a board was the time and resource of trying to explore recommendations discreetly. And so what we're saying in these recommendations is that we use these recommendations as a core part of our approach to implementing the health and wellbeing strategy, which underpins our board. And then in terms of the core ambitions in that strategy, do they need modifying or learning or adapting from what we learn from these assessments? So it's about wrapping in, the recommendation is about wrapping in these impact assessments and their recommendations to our core work, rather than replicating or duplicating. And further, what's really important, was noted by many people, is that it's so important to make sure, and this is really, really important for health now and in the future, that partners who these recommendations and these actions have impacts on, they've got to be shared. We've got to make sure they know about them, and actually, even the people we don't normally engage with, we need to make sure that they reach them. So that's important. And also that once those are shared, that we as a board really engage in that feedback and that dialogue, so that it's not just a one-way street. So I think that really sums up what we're saying today. So I mean, that might want to form based on any clarification questions to Eleanor, any comments on that approach, endorsement or otherwise, that I'm really happy to hear today. But I would also like to thank the comments made outside this meeting by members of the board, which is really appreciated, and also the work done by not just the hundreds of people involved in drawing up these impact assessments, but also those that helped everyone to work through them and come up with a plan today. Yeah, so any comments or questions? Not seeing anything immediately. I suppose it was then for me really to say, are we comfortable with accepting the recommendations as laid out in the paper in the terms I outlined? Do we see any dissent from that? I hear some talking, but I'm not sure whether that is an attempt by somebody to. Mark?
I'm not going to dissent. It was just a quick comment on one of the recommendations about sharing the recommendations with partners. For other board members' awareness of the Accountable Care Partnership, we have an ACP website, and we've got some material kind of ready to go to put on there, which there's kind of one-page summaries for some of the strands of those rapid impact assessments. We'll liaise with Eleanor to sort of get those uploaded, but I think that's one way through which we can share some of these. I mean, there's reference in those one-page summaries to the much longer material, which I don't think we do just sort of necessarily just put up there on the website, but those summaries we're absolutely committed to do as an illustration of that recommendation. So.
Thanks, Mark. That's really helpful. Throwing Terry, I think it's worth noting that absolutely we've kind of put we put a marker down today by having these published, but absolutely there are many ways which we can communicate these things, because absolutely there's no point publishing anything if you can't communicate that in sensitive and appropriate ways and through the right channels. So I'm sure that will be a welcome offer there, Mark. Can I bring Terry in, please?
So I'm in a position where I'm happy to personally, I'm happy with the recommendations there. With just backing up what Mark has said, a particular recommendation that we really do push to share this learning with partners across the system. So Mark has articulated there that the ACP has a whole host of material which is almost responding to those recommendations, and I think in future it may also be incumbent on our commissioning organisations also to be looking at whether their plans reflect some of those recommendations that have been made from the rapid health impacts in future. So certainly those things do need to be considered, and certainly it will be good to see some of those considerations reflected back here at Health and Wellbeing Board in future. And then just one final thing, also thanking all of those involved in the health impact assessment. I think the Health and Wellbeing Board should also acknowledge and recognise the huge number of people who have been involved in the response to those recommendations that have already occurred across our health and social care and voluntary sector partners.
Thank you, Terry. Any other comments on this item? No, I think that's great, and I think from now we should really have a really good path forward with a number of organisations, including that kind of from the ACP, to really make sure that we can make the absolute best of these recommendations. We shouldn't ever move away from the fact that this is in the end about protecting people's health in the short, medium and long term, and understanding impact is a really, really important tool for doing that. So we can't thank those involved enough, really. Right, so next we have got an update from Health Watch, which is, I believe, a verbal update. Judy, are you going to give us a brief update here?
Yes, I am.
Great.
Just perhaps a reminder to the board that this came out of a recognition that some of the immediate feedback that comes to the ground isn't a piece of research, but is an indication perhaps of what might be bubbling up and is useful to note for future reference. So I'm going to talk about 5 areas, but very briefly. And the first one is about care homes. Health Watch has been part of a national piece of work called John's Campaign. It's about visiting people in care homes, mainly with dementia. And it was done in November 2020, so it's very recent. And we've extracted the parts of that survey, national survey, that relate to Sheffield. And in Sheffield, there were 23 responders in 18 different care homes. And briefly, I know there's been a lot of difficulty about the guidance in respect to visiting, to do with changes of tiers and all that. But I think some of the things that really stand out, of those responders, only 5 carers or relatives had received regular updates about their relative. 11 had had none at all, and others had a little bit intermittently. And I think there's a much longer report, but the gist of it is about the importance of communication, how isolated those carers felt, and because they couldn't visit, that need for a link, and sometimes doing that imaginatively, was really vital, and too often wasn't happening. We will be publishing the full report, but I think it's that nuance of what people need and how painful this period has been that services, I think, really need to reflect on. I know it's been hard, but I think that communication would have made a huge difference. So that's one. The second one, I'm not going to talk much about at all, but we're just about to publish a report about carers and GP services, particularly carers who themselves are not well. And that also, I think, is important to look at. And carers are so vital to keep other people out of hospitals. If we don't look after them well, the cost to the system is considerable. The third one I've mentioned, and we mention nearly every time we do these reports, and it's about dentistry. And similarly, a communication issue. Health Watch has been trying to get some definitive guidance from the Dental Council about access to services, about what's urgent and what isn't. And we consistently get feedback that people can't get appointments, they can't find out what's going on. And that has a really big knock-on effect on their general health. Now, I know the CCG doesn't commission dentists and so on, but there's a well-being issue. It's one I think we can't ignore. And then a bubbling up one, and it does relate to what we've learned, I think, about the AME communities. And there's been national work done on maternity services for particularly Black women, but BAME women in general. And we're starting to get some feedback around that. And we're going to be doing some more work on that. But colleagues may want to note that, and anybody finding anything that we could incorporate in that work, we'd be grateful for. And then the last one is something I've spoken about too often. And it's not a large number of people, but it's an illustration, I think, of how getting services right is both difficult and important. And that's about interpreters, particularly in hospitals, for deaf people. And we, again, consistently get feedback that people don't get the information they need in the way that's accessible to them. They turn up for appointments and they simply don't know what's going on. And we've reported that, I can't think how many times, we've engaged with that community and they're well organised. Things are not changing. And I think that does relate to the next piece of work. You can engage as much as you want, but if services don't listen, then there is a real issue. And that one is a consistent issue for a very vulnerable and often very isolated group. So there are some things that we keep saying, there are some things bubbling up, and some reports and pieces of work we're going to be doing in the future. But those are our, not quite finger in the air, but the sort of things we've been finding out this last month. That the full report about those issues is on the website, and the report about care homes will be there as well soon, as well as the one on carers. So if you want more detail, but I think it's how we thread these things into our future thinking and planning that really is critical to doing things right and putting people at the centre. Thank you. I'll take any questions.
Thank you very much for that, Judy. I think some really important points there, particularly of your first item around the differential experience of those people and families in care homes. I think it's such an important role that Healthwatch plays, along with your partner organisations across the country, in really understanding the experience of those people who are more vulnerable, more isolated in health and care settings, especially these hardest times. Do we have questions for Judy or any comments, please? I can bring Terry in if that's okay.
So Judy, firstly, thank you for the report. Lots of things that we really do need to be thinking around. Personally, quite disappointed that we've come back to issues that were identified some years back around interpreting services. There's clearly an awful lot more for us all to do across Sheffield to try and remedy that situation. Second point is around the dentistry services. I know previously we would have had representatives from NHS England sat at our Health and Wellbeing Board, and we haven't for some time. But I'm just wondering, George, whether you and I might need to feed back what we're hearing. Although nobody here is in a position to commission that. I do think if Healthwatch are flagging that up, then perhaps the board might want to just pass that information back on to NHS England colleagues to make sure that it has been flagged up with them.
Terry, I think that's an excellent suggestion. The other thing I would say is that I don't know if board members are aware that Terry and I, along with officers, met with the Sheffield Scrutiny Committee on healthier communities. And I know that there are some issues that we can potentially work with them, as well as flagging things up directly, in order that perhaps in some occasions, particular areas of scrutiny can be of assistance, and also some items there, Judy. I mean, I note from my institutional knowledge that the things that they have potentially looked at in the past or more recently, and so I think that might be a really that Healthwatch link there, and the important information you uncover actually might be a good way of strengthening our relationship with that scrutiny committee as well, because I think they play a different role to us, and although we can absolutely raise things, and I'm very, very happy to be at the forefront of raising things with NHS England, our approach is always going to be that more kind of direct role rather than that scrutiny role, which is a very valid thing. Can I ask if there's any other questions or comments for Judy or anything that Judy said? John?
Just a comment, George, and Judy, I think you've probably done some work with my colleagues over recent times. If not, we'd welcome discussions with you. Everyone's first instinct was during COVID was the importance of visiting and maintaining those links, and a lot of effort's gone into try and work around the national guidance about risk, but to maintain that really important support that both families and the residents need as well. So we'd like to continue that dialogue with you and the learning from it. So I think just a really valuable feedback, and that ways people can keep in touch and be keep that contact going, whatever the circumstances, are critical and essential to good care and support. Thank you.
Thanks, John. Anything else from anyone? If not, I think I'm going to say thanks to Judy as always, and to Healthwatch, your team at Healthwatch, for this valuable role. I think actually we need to keep that in mind for our next item in terms of the role you play, because I think that's really central. But what I'm going to ask now is just if we just want to take just a 5-minute break, which I'm sure we'll all appreciate, and then we'll hopefully get Greg to join us as soon as possible. But I know that both Dan and Rosie will be able to start the next item ahead of Greg's arrival, should that be necessary. So yeah, we'll just take a break until 5 to 4 by my clock, if that's okay. Thanks everybody, see you soon.
Just a quick reminder that we can't stop the live stream, so just be careful what you say during the break.
Be very, very careful, everybody. Thank you. Hello everyone, I think we'll resume as soon as possible, but I'm still seeing a few people behind black screens, so we'll give them a little moment to flash back onto our screens. I am aware that some people may not rejoin us because of time issues. Okay, hello everybody again. We are now going to move on to our next substantive item, for which we are hoping at some point to be joined by Greg Fell, who'll probably be thrown from one Zoom to another to join us within the next few minutes. But for this Health and Wellbeing Board engagement item, I'd like to first ask if Dan and Rosie would like to introduce this for us.
Thanks, George. So I'm just going to say a little bit about the context for this item in the board's work, and I think Rosie will talk a little bit more about the contents of the paper and the recommendations it makes. For context, when we undertook a review of this board's ways of working in 2016-17, one of the aspects that was touched upon in that was its approach to engagement with the population of Sheffield, and there was a general consensus at that time that the approach that was being taken wasn't delivering what it needed to ensure that the work of the board was appropriately informed by the experience of people in Sheffield. Their steps have been taken to address that over the last few years. So there's been some success in terms of bringing the voice of service users into some of the board's discussions. We've also put in place a small commission to Health Watch and VAS to do engagement around the ambitions set out in the joint health and wellbeing strategy. But I think it's also safe to say that we probably haven't nailed it as we would have liked to yet. I think the issue has been sort of reinforced as important over this last summer. In particular, the PHE reports on the unequal impacts of COVID-19 identified a real issue around engagement and understanding the experience of people in the communities and groups that were experiencing those unequal impacts. And I think the board sort of agreed that we needed to make further steps in relation to that. One of those was considering, as part of the terms of reference, setting up a citizens panel, which we sort of signed off in September, that they are yet to go to full council for confirmation, as part of diversifying the range of voices that are contributing to board's discussions and its development of strategy for Sheffield. It's kind of key as this work develops that we want to avoid a piecemeal approach. We recognise its importance in ensuring we have something coherent. So the purpose of this item is really to kick off a discussion how we ensure that that is what happens.
Thank you, Dan. Rosie, do you want to speak now?
Yeah, so I won't recap the paper. I assume everybody's read it, but basically I think it's just looking at having a steer from the board on a couple of things, and I'll put the questions in the chat that we probably should have a discussion about. Essentially, where do we think we've done well in engagement in the past, and where do we think the gaps are, particularly around any of the ambitions that we feel that we are less well informed about the public's view on, and where we might want to do a little bit more engagement. Similarly, which groups we haven't managed to hear from enough. We may have heard from particular demographic groups or communities of interest or identity, but other ones we may have been less good at reaching out at. And then I think really big issue, apart from the sort of what we want to talk about and who to, is really about how we can coordinate our engagement. As we've sort of mentioned previously, there is a lot of engagement happening across the city, a lot of really good engagement, but it may be that if we manage to join forces a bit better in what we're doing, we might be able to actually channel more resource into sort of better quality engagement that is joined up, rather than us all going out and speaking to the same people again and again. So I think it's the main recommendation of the paper really is about establishing a working group to help us map out the existing engagement channels that are in the city already, and where we might be able to collaborate and coordinate, join forces. Yes, because we're often asking very similar questions as well. And the other issue is about not just the engagement for this board, but the engagement that other boards and other organisations in the city are doing. So there is also some work that the University of Sheffield is doing, engagement around health in the city more broadly. And so we will be working with them to identify how we can join up with, for example, the Sheffield City Partnership Board, and collaborate again on engagement there. And then I think the final point really is, as Judy was saying, engagement is all very well and good, but it's only good if you listen and take action. So the final point is really how we can prove that by doing engagement, we've actually changed our policies and practices in the city based on what people are telling us. It can often be quite hard to map a engagement project in a small area in Sheffield to a major policy change. But I think if we are to continue carrying out meaningful engagement, we probably do need to be able to demonstrate that we have listened and that change is possible. So I think those are the questions. I'll hand over to the board now to discuss. There's quite a lot there, obviously. But the main recommendation is to establish a working group that will present a paper to the March public meeting outlining a hopefully coordinated engagement approach for the board.
Thanks, Rosie. Not to limit anyone's contributions at this initial stage, but I just want to wonder if anyone has any particular kind of questions of clarification or more basic things to start off with, knowing that particularly Greg may want to contribute something meaningful discussion should he arrive in the next few minutes, but if he doesn't arrive, we'll obviously then expand this further. Bring Dawn in.
Thanks, Rosie. Yeah, this is really relevant, I think, but I don't know if it's relevant to these questions. But what are we going to be doing about representation on this board? Because I've just spotted that we're all white on this board. There is no BAME representation. There's no voice on this board. So while we're out engaging in communities and bringing the voice back, where is the voice on this board, and what are we going to do about that?
Thanks, Dawn. I mean, I think it's a really, really valid question. Whether that's something for obviously Rosie to answer or more for us as a board to tackle. So what I would say is that I do think that if you look at the previous principles we've set out as a board, one thing is obviously we've underlined the importance of breaking down some of the barriers of the board in terms of making sure that we are hearing from more people and being less controlled by the actual members of the board. But that does in my personal view, that in no way means that we should leave aside that question of representation in itself. It is absolutely something that we have discussed and we absolutely need to discuss again. My view would be that in terms of this paper today, we ought to try and get to a place where we are able to ensure that we are reaching out to everyone we can. And then in terms of the discussion we had at the last public meeting, we obviously need to be talking further about the exact representation of the board, but being very informed by the approach we take here. Any other contributions on that point particularly? But I think it's very well made, Dawn, and you're absolutely correct
Thanks, George. I'm just
I think I would reassure it's
questions.
absolutely something we are returning to, and I feel that this has to enhance our response to that, not replace it.
Yeah, I just think it relates back to the questions of who do we feel that, which groups do we think we need to hear more from? Well, there aren't representations on here to tell us that. And also the bit around how we encourage engagement and decision making. Well, there aren't the voices in the, and young people either. There are no young, your youngest dear George, I think. Well, Rosie looks quite young as
Only
well.
by a few years, I'm sure.
So yeah, didn't want to complicate matters, but I just think we need those voices to help us with these questions as well.
Thanks, Dawn. No, that is a very valuable input. Can I ask, have we got any other comments? I'm very happy to have more wide than my initial suggestion. Maddie.
I absolutely echo what Dawn says about the makeup of this board. We've got a VCS representative who has stood down. There's an opportunity perhaps to think about how we fill that role, although I don't want the VCS to always be the people who bring other communities into a room. A challenge we talked about at the partnership board last time was that we can't wait for people to come through the statutory organisations on promotion to fill roles that are the ones that we fill here before we bring in other voices to the room. So that is a real challenge, which is the same as that one. So we can't wait for a new director of whatever, or a new chair of whatever organisation to be the point at which we bring in people of colour, for example. So perhaps we need to bring in people because of the skills, the experiences that they've got, the perspectives they bring to this board. And I think that's really our gift to do now. So I'd encourage some sooner, rather than saying, well, think about it, talk about it. We could make a decision today to invite some more people to join the board. The 3 points that I wanted to make are, I'm afraid, not related to the questions so much, Rosie. One is that if we're going to ask people to bring their perspectives and views forward, we need to be prepared to invest in it. And if we as a city are continually going to communities saying, give us your intelligence, but we're not prepared to pay for that intelligence, it feels that we're just stripping assets from communities. So we need to be prepared to invest in people's time and commitment to share with us what their experiences are. I think we need to be realistic about the job of aggregating those experiences. There's about 10 groups listed in Rosie's paper, and kind of a slightly, we'll just bring those engagement exercises together. It takes quite a lot of time to aggregate and distill the messages that are coming forward and make them usable to inform decisions. So I'm going to think about how we do that and really commit to it. And there's an example. Healthwatch is responsible for kind of looking at the whole of the health and social care system in Sheffield, a population of just over 500,000 people, and it has a budget of £210,000 a year and a team of about 5 part-time staff. It's really insignificant, it just isn't enough. So how do we invest as a city if we really mean that we want to elevate and listen to more voices? And the final one, which is in Rosie's list, is we need to really commit to acting. If we're asking people to spend their time to tell us what their experiences are and what matters to them, we need to really commit to taking action as a result of that. And I'm not sure that as a city, we're very good at doing that at the moment. I don't think we're good at taking action as a consequence of what people have said. Judy was talking earlier on about the deaf signing access, access to interpreters. Sorry, I got my teeth in. About access to interpreters. Well, we've listened, we've heard there's a problem. We haven't taken sufficient action to address that problem. Health inequalities, we know is a massive issue. It's been almost a perpetual issue. We haven't taken enough action to address it. And even for this board, we've got a health and wellbeing strategy, which has got 9 strategic aims to it. And the engagement that we did with communities said that actually my neighbourhood and my community is the most important thing to me. And we've not really kind of fed that into that strategy and reflected it. So I think we really need to commit to taking action as a consequence of what we're hearing and not just do it to tick a box.
Thanks, Maddie. No, that's very valuable challenge, and I think we need to reflect on the fact that clearly there are some more core parts of the discussion that perhaps we need to make sure we're doing it in the right order, particularly. I'm just going to bring Judy in, but then I'm where Greg's arrived, so then I'll allow Greg a chance to have a contribution too. Judy. Yeah,
thanks, George. Yes, following on, I suppose, from the points that Maddie was making, I think it's really important to look at what we already know. And I'm thinking about some of the groups that Rosie noted in the paper, where if you were to look at Health Watch's back catalogue, you'd see work on all of those things. I'm afraid too often, but not responsiveness. So I think that really is important. I think we need to thread through our future plans what we've learned, and too often it's as if it's year zero, and I think that really gets frustrating, particularly for people who've shared their concerns. So that's one point. I think the other one is about responsiveness of services. I think the other one is about doing things together is much harder than it sounds like on paper. So Health Watch, when we were trying to do some work on people's experience of services around COVID, we wanted to do it with, I think, the CCG. The CCG have statutory regulations about engagement. We were wanting to do it in a slightly different way. And we've tried really hard. We just couldn't bring those together. So that's sometimes why that doesn't happen. Not a lack of willingness, but the regulations with and the frameworks within which people operate are different. So that's the other one. I really heartily agree about that point about the board itself. We said that 6 months ago. I remember raising it. We also said we'd go out. We'd stop doing it either on, in the town hall or whatever. We'd actually go and be hosted by a community, say. I don't see any reason why we shouldn't do that. I don't think we need a paper about it. We need just to do it. Thanks.
Thanks, Judy. And I think it's valuable, especially that last point in terms of where we need to be as soon as there's absolutely virtual engagement we can have, but it's also, I think, the very valuable part of making sure that as soon as we are able to do that perhaps a more valuable physical side of engagement, we do that right. Can I bring Greg in now, because just to comment on this paper and any views you have on it?
Thanks, George. So apologies being late, and I'm coming in halfway through a discussion, so I'll be careful. So I'm not quite sure what I haven't heard. But views on paper, I think paper is good. No real disagreement with it. And I agree with the recommendation about working group, but I wouldn't overlabour the working group. I think what I heard from Judy is that we've had these discussions before. We have some strength. Let's build on the strengths. I wouldn't overlabour another working group that will tell us probably where we are now. There's something about kind of getting on and doing the things that we have said that we would do. And one of the things that does really concern us all, I know we've discussed this before, is the sort of bringing new voices into these discussions to solve collective problems and to add value to collective problems. So we none of us know the answers to some of these problems, and to be honest, probably nobody does anyway. But bringing new voices in and deliberatively doing that, I think when we've had conversations, perhaps not in formal health and wellbeing board meetings, which have been a bit more discursive and a bit more workshop style, they've been really good. Sometimes we haven't followed through on those as well as we might do, but the discussions have been really good. But that needs engineering, and we all, not just Dan and Rosie and me, but we all need to commit to doing that engineering, because Dan, Rosie and me can't do that by ourselves. So if we go there, I think we should go there, but we all need to commit to the work in engineering it. And I know we're all busy, so if we're going to go there, then we need to be mindful that we can't just lump it on Dan and Rosie.
Thanks, Greg. I think that's some valuable thoughts there. And yes, I do think there is a broader point about when we talk about engagement, all in Health and Wellbeing Board, it will be at its most valuable when the broadest group of stakeholders from the board can play our part. It's not just about a broad group of stakeholders to engage with, but actually having that engagement touch as many parts of that board as possible, because I know we bring so many different things. Can I ask, we've got further comments, questions, or thoughts about the recommendations on this paper, please? I mean, Terry in.
So I endorse what Greg said previously. I think there's a really important point in the paper, which is 5.2, and its subparts there, which I think was kind of really where our conversations needed to be more geared towards today. You know, sort of particularly around, you know, are we signing ourselves up to having that discussion and really beginning to almost ensure that we've got that broader range of views and the appropriate range of views to help with the decision making here at the board. So I think whilst it's probably going to be an important thing for members of the board to volunteer to be involved in a working group, I think sort of taking on board some of the comments we've heard already is, how do we know who we need to hear from if we haven't got the right people there that know their communities? So within that working group, I would make a request that we don't just involve members of our existing people around the table here, or some of those existing assets and networks, but we do reach out more broadly and consider making sure that we've got a really broad range of people, because if we don't do that, we'll be in a territory of unknown unknowns. So I would endorse the approach that the paper's taking, but would suggest that might be a helpful way for us to take the work forward in the working group. I agree with what Judy said. You know, there is an urgency. You know, we do need to get on and do this, but equally so, the logistics of, you know, organising meetings in different areas, different communities, etc., can sometimes take its toll. So I think that's where individual organisations that sat around the table here could contribute some of their resource into that working group to be able to help make that happen.
Thank you, Terry. Do we have any more questions or comments around the board? If not, what I will say is I endorse the paper, but I'm also, you know, I respect what Maddie and others, the point made around the representation point, and it's not really a separate point in long-term goals from engagement, in that I feel that it's certainly something we've got to answer. Absolutely, it's something we addressed at the last public meeting, but I feel it's something that has to be really well wrapped up alongside our future approach to engagement, because it's something we're rightly be challenged on, and absolutely we need to change on. I would reflect that neither by diversifying our board will we represent all communities in Sheffield, and therefore engagement and good engagement always needed, nor will the best and the most well-crafted engagement strategy mean that those we engage and can be involved in all of the discussions, which there emphasises the need for a diverse and representative board. So we can't have one without the other, and therefore I think I would recommend to the board alongside this that we just look to do what we can to make sure that we are ensuring that those two pieces of work that we're committed to, both in the terms of reference report at last meeting and if we agree to recommend today, that we are cognizant that they are developed not as one piece at all, but as in conjunction, and that we are aware and that we progress those both as speedily as possible, because I do think that both are will be enhanced by the combining of those, and I recognise the demand that we do move as swiftly as possible to ensure that we are really living up to the principles that we've agreed before on the representation elements of the board. Does anyone else have any other comments or dissent from recommendations as outlined? Judy.
I've missed this, but I noticed a point about the citizens panel. And I mean, I have some slight concerns about that. I think we need much more nuanced work targeted at specific communities, bearing in mind that whole thing about the blind spots that Terry noted. So I'm less keen on that. I think it takes up a huge amount of resource and work. I'm not sure what you get back from it. We have tried it in the past.
Thanks, Julia. That's a very important. What I would suggest we do with that point, that noting your objections, is that, and I'll bring Terry in a second, is that, well, I'll bring Terry in first, actually, before I suggest something.
Yeah, it was around the citizens panel point there. I think we may need to just do some work on exactly what the citizens panel is. So I think if it is a citizens panel that is, you kind of go to audience when you need engagement, then I agree with Judy that wouldn't be the right approach for us to take. However, a citizens panel that is more broad and representative of people across Sheffield that could help point us in the direction of where we need to engage in more depth and more nuance, I would welcome. So I think, we might need to do some work around kind of imagining exactly what that type of panel would look like.
Yes, Terry, that's a good point. The point I was going to suggest was that, noting your point, Judy, in the future action, or in the actions from this item, we consider what form any panel could take, and whether it is indeed the most appropriate use of resourcing to achieve the broader the broader outcomes that the report aims us to try and achieve, really. So I think absolutely noting noting concerns there, and also being rightly concerned that when resources are limited, trying to move away from things that might be seen as not specialized enough and overburdensome. It's very, very good thing to be aware of. But I also think it's something we need to consider fully. So is that okay, everyone? Is everyone happy with the noted points? I don't think there's too much discrepancy there to agree to the recommendations. Is that all okay? I'm not seeing too much from anyone. Say anything else? Fantastic. So then, that then brings us to the end of our scheduled items. Next, I'm just going to the minutes of our previous public meeting, which were held in the pack, which is held on the 24th of September. We've referenced it a few times. What I just want to do is just go through the 8 pages we've got here, and if anyone has got any particular points of accuracy or anything they want to raise, please do. I'll just go page by page, and just with the numbers here, please just say if you've got anything you want to raise. Page 1, page 2, page 3, page 4, page 5, page 6, page 7, and page 8. Has anyone got anything to like to say before the approval of these minutes? That's great. I will see them as duly approved then. Thank you. And now it just falls me to confirm the date of our next public meeting. We'll be having our next public meeting into the new year on the 25th of March at 3 p.m. I think we'll, for the moment, assume we will all be here sitting on Zoom again. And the public, of course, as always, welcome. If we've got any other items of urgent business, anything anyone else wants to raise before I close the meeting? All it remains me to say is thank you all for your contribution today. This being the last meeting, or one of the last meetings we'll have in these forums before Christmas, wish everyone a good break. I hope people get some kind of break in the health and care system, and Happy New Year. Thank you all.
Thank you.
Thanks, George.
George.